Good afternoon, everyone. My name is Monica Valdez-Lupi, and I'm the Managing Director for the Health Program Team at the Kresge Foundation. We'd like to welcome everyone to this afternoon's webinar hosted by the Vaccine Equity Cooperative, where we'll be able to hear more about standout communities in the Southern United States. Next slide, please. And you can go to the next slide, please. So before we begin with our panel's remarks, I thought it would be helpful to say a little bit more about the Kresge Foundation and how we've been working to support our grantee partners in their efforts to respond to COVID-19 over the last year and a half. In 2020, the foundation provided nearly $19 million in grants and investments to support nonprofits confronting the COVID-19 crisis nationally and in cities across the U.S. These resources that we provided last year helped organizations do things like purchase personal protective equipment, which we know was in deep shortages last year. It also helped support providing legal services for eviction prevention activities on the ground. The resources also help provide support for other needs that the community members lifted up to us, including childcare and transportation services. This past spring, we provided nearly $5 million to support the equitable distribution of vaccines, and much of the work that we were supporting was carried out by community health workers and other types of community-based teams. We've also partnered with the CDC and the Beaumont Foundation on the Public Health Communications Collaborative to provide timely and accurate tools for effective messaging for the public and also policymakers. Next slide, please. I also wanted to highlight work that we've been doing to support our public health leaders, and you'll hear more from two of our colleagues from the Emerging Leaders in Public Health initiatives. While many of our public health leaders endured really difficult and challenging personal and professional moments over the course of the pandemic, I always like to highlight that many were also recognized for effectively leading their health departments and providing critical services to their community members. And this is just a snapshot of some of our ELF leaders who did amazing work throughout the year. Next slide, please. We also wanted to highlight some other national partnerships that we've been engaged with, because we know that while many of us in the field have been focused on the short-term challenges that COVID has prevented, we also have a long view in terms of the work that we want to be able to advance. And so these are just a few examples of the work that the Kresge Foundation has done in partnerships with other national groups and coalitions. The first is Public Health Forward, which is a collaboration across these organizations that you see on the slide to help support in a bipartisan way defining a vision for what the 21st century governmental public health system needs to look like across multiple levels of government to be effective at promoting and protecting health and preventing diseases. The second is a cross-organizational alliance that is led by American Public Health Association partners, and you see some of the partners that are involved on the alliance to support the opportunity for everyone to be healthy and to ensure that we have what we need and what we know we need in terms of a comprehensive public health infrastructure to not only protect us from COVID-19, but also for future diseases and health challenges, which we'll all inevitably encounter. And finally, with the Vaccine Equity Cooperative and Health Leads, we're also part of a Pandemic Action Network, or the PAN. Next slide, please. Another one of Kresge's key initiatives related specifically to vaccines is the Vaccine Equity Collaborative, or Cooperative, which is a national collaboration of community health and health equity-focused organizations, which includes Health Leads, Partners in Health, Convince, Native Ways Federation, and the National Association of Community Health Workers. Like many of you, the cooperative anticipated the racial inequities that we would see as vaccines were rolled out across the U.S. And we all believe that while community-based and public health workforces are critical to that effort, we recognize and appreciate that they've long been under-resourced. We also know that our COVID response and vaccine rollout work have sparked a movement in health equity, which we're all aiming to fuel. We're going to drop a link in the chat box to a blog post that the cooperative team wrote on that very topic. Next slide, please. So in terms of the cooperative's work and our approach, I wanted to emphasize that we're focused on 3 areas. First, increasing access to trusted health resources. Second, expanding investments in community-based organizations and other local organizations and supporting hyper-localized approaches. And third, strengthening policy in support of community-based and public health workforces. Next slide, please. On the last point, last month, the cooperative launched an online resource hub, which you see here, some screenshots of that hub that really is aimed at offering easy access to trusted, curated, and up-to-date information, tools, and case studies to support COVID-19 vaccine access and readiness. It was designed for community-based workforces by community-based workforces because we know that CHWs, promotoras, public health professionals, community and faith leaders are all vital to successfully engaging people around vaccine access and readiness. A few features of the site that we wanted to point out. It's community specific, so there are customized toolkits by race and ethnicity. There's 6 on the homepage now, but there will be more, as well as some toolkits by age group. This was actually something we heard from community-based workers, that there was plenty out there for the general population in terms of resources and tools, but not a lot available that was vetted by their peers for specific community groups and populations. It's also designed to be bidirectional, meaning that people can share and submit resources in events, ask questions, and get connected to colleagues to share learning and do that peer-to-peer exchange that we know has been difficult to do in a virtual space.
Oh, Monica, I think we've lost your audio. Okay, well, while Monica reconnects her audio, Monica, are you back with us?
Little technical issue here since my call was dropped. Can I get a thumbs up from panelists if you can hear me?
Yes, we can hear you.
Thank you, Diana. So we're on the next slide. I think it's slide 9, please. Thank you. So right now we know that the country is in the most critical and difficult stage of the COVID-19 vaccination effort. Despite having ample supply, we need to implement a highly customized, place-based and community-centered approach to vaccine distribution to eliminate barriers to both vaccine access and readiness. Today, we are going to hear from panelists in Arizona, Oklahoma, and Louisiana who will share the best practices and lessons that they've learned on how to overcome these barriers and how they've been able to successfully increase vaccination rates in their respective communities. I've had a privilege to meet and serve as part of the ELF cohort with 2 of our panelists. And our 3rd speaker, who I'll introduce, I just recently met earlier this spring, but in the last couple of months that I've been able to talk with and learn from her, have seen the amazing work that they've done in Louisiana. So we'll start our panel discussion this afternoon with our colleague, Diana Gomez, who serves as the Chief Health Officer at the Yuma County Public Health Services District in Arizona. Diana will be describing the ways in which she's leveraged partnerships with local harvesting companies to vaccinate their migrant workers in Latinx communities and implemented different messaging approaches to break down language accessibility barriers. Diana will be followed by Dr. Patrick McGough, who serves as the Chief Executive Officer at the Oklahoma City County Health Department in Oklahoma. Patrick will describe increased vaccination rates in the Asian American Pacific Islander community that they were able to achieve by building a partnership with the Asian District Cultural Association and how they were able to partner with them to recruit AAPI volunteers to join in their Medical Reserve Corps efforts to run vaccination pods in their communities. And we'll round out our panel presentations with LaTanja Sylvester, who is the Louisiana Director for Resilience Force. LaTanja is going to talk with us about how they used a community organizing approach and how they leveraged the strengths of community health workers and partnerships with trusted partners and culturally competent organizations in New Orleans, which led to a 60% vaccination rate in their community, and an approach that I know she'll describe may be scaled in other regions and parishes throughout the state. So with that, I'm going to hand off to Diana to share her remarks. Please put your questions in the chat box and we'll have lots of time following the 3 presentations for Q&A. Diana?
Hi, thank you so much for the introduction. It's a pleasure to be here, part of this panel with everyone today. My name is Diana.
I think you're on mute.
Oh, you can't hear me? You can? Okay. So my name is Diana Gomez. I'm the Director of Public Health for the Yuma County Health Services District. Our health department is located in Yuma County, Arizona, which borders California to the west, and we go along the US-Mexico border, Sonora, Mexico to the south. So we have, every year, Yuma County is responsible for providing between November and March, Yuma County produces about 90% of the leafy vegetables for the country, which makes our county #1 in the state of Arizona and #3 in the nation for vegetable production. What this means is we have a lot of we have permanent workers, migrant health workers, and H-2A visa workers that visit our community every year to be part of our agricultural industry. And so as we saw the vaccine start to roll up, we knew we needed to address several issues. We needed to address access to vaccine, health literacy. There was some trust issues. Many people were hesitant about the vaccine to begin with, and the fact that it was a government agency that was promoting vaccination was another issue that we needed to work through. So can you please forward the slide? So our primary approach was we knew right away that we needed to partner with the local harvesting companies. So what you see on this particular slide, you see one of the local farming community harvesting companies, Taylor Farms. And if you look at your salads, you probably recognize the logo. One of their plants here employs about 1,200 individuals. So we knew that it was key right away to reach out to them and start planning right away. So what we did was we did a combination of work site clinics where we actually went to the work site. We took shifts. We worked in partnership with the company. The company actually, we provided the registration forms, all the vaccine literacy procedure. We went over there and we provided an overview, answered any questions. And then we actually showed up and provided the vaccination. We also did work site. We did the work site ones. We also did field outreach and provided vaccination on site. So if you look at the picture at the bottom, you can see that is our health department parking lot, and you can see a lot of the buses are there. So what we did was we had a triaging station and we had the different companies scheduled at different times. They actually did all the registration for us, but were able to bring in their workers in shifts. We provided the vaccination here on site at the health department. And during the 15-minute observation period, we got an opportunity to ask questions, assess some other issues that they might, or questions they might have, vaccine hesitancy questions that they related to us, that maybe a family member or a friend, and they wanted assistance on how to broach the subject. So we provided that to them. And it also provided us an ability to follow up. Next slide, please. So the other thing that we did was we understood that health literacy was a big part of this. And we were also concerned because when you're harvesting, you're in close proximity when you're traveling, when you're going on the bus, when you're actually in the fields harvesting and close proximity. So we worked with a lot of these companies, not just on the vaccination front, but also as far as COVID safety measures, prevention, and testing. One of the things that we did, if you look at that particular slide on the left, you see Grow Shippers Association. That's an organization that we partnered with. And what we did with them was we worked really closely with them to address obviously the vaccine hesitancy issue, but also wraparound services. So if somebody actually tested positive for COVID, we provided health checks, they provided housing, we provided the ability to follow up with them on a daily basis to make sure they were okay. We also worked with the different companies that they worked for to provide vaccination on site or again in the fields. A key component of this was using our local promotora workforce. Now, the promotora program in Arizona was started many years ago in a pilot project called Health Start here in our health department, and it has expanded since then. But the community has embraced the promotora models. They're trusted, they know them. Every year, the promotoras go to the different harvesting sites right on site to provide outreach as far as regular vaccine, flu vaccine, and chronic disease information. So they knew the companies trusted them, and the employers and employees every year are used to seeing them. So they worked with us to go out in the field and do a lot of this outreach. The other thing that we did was we partnered with the Centers for Disease Control, and we had 3 separate teams come out here. And what they did was they worked with us to work with the local companies to, again, evaluate vaccine hesitancy, to address some of these outreach efforts that we knew were going to be critical. They also conducted a survey to help us evaluate mobility patterns and migration patterns, because we knew that when the vaccine became available, we were going to be able to reach a segment of the population, but a lot of them travel back to other parts of the country, particularly Salinas, California, during the end of the harvesting season, which tends to be around March. So we were able to vaccinate many of them with our first and second dose, but many of them required a second dose when we knew they would already be migrating with their families to California. So we worked with the CDC, our local FQHC, and the Grow Shippers Association to coordinate the provision of second vaccine doses in the communities in California that many of our migrant workers were going to. We also set up pop-up vaccination sites in our community. We work with local municipalities, and we set up in community centers. We set up in the agencies that many of these farm workers are comfortable reaching out to. And we created targeted educational materials for them in Spanish. And again, with the promotoras being our lead trusted partner. Next slide, please. And so one of the things that we really relied on was making sure that we address the misinformation. So you can see that the graphic on top. One of the things that we did in our community was we hosted a tele-town hall. So our director at the State Health Department worked with us and provided English and Spanish language tele-town halls. So there was a canvassing about 20,000 local phone numbers, and then they were able to participate and participate by asking questions live during the town hall. But if they had additional questions that didn't get answered, those were forwarded to our health department. And then our staff followed up and answered those questions and helped people register for vaccines or coordinated with a local site in their community to make sure that they were able to register somewhere close by. These telehalls were important because they allowed us to address barriers like transportation needs, and also allowed us to set up a task force that provided vaccinations for homebound residents. We worked again with local jurisdictions. When addressing migrant farm workers, we knew that many of them came from Sonora. So we worked with our binational partners and the Secretaría de Salud across the border and the Office of Border Health at the Arizona State Health Department to coordinate messaging. We partnered with the Mexican consulate and hosted clinics in conjunction with them. And we worked with the University of Arizona as an academic health department partnership that we have to be able to provide PSAs, targeted messaging. And those PSAs ran on both the English language radio stations, but also in the Spanish radio stations on both sides of the border. So we ran them here in Yuma County and also in the radio stations in Sonora, Mexico. We also have an agency called Campesinos Sin Fronteras that has a radio station, and their whole mission is to serve our migrant farm workers. And so they were an integral partner in making sure that we got that messaging, assisted with coordination of vaccine and just setting up a lot of these pop-up sites for us. Next slide, please. And so again, this is just, it's one thing to have a plan as a health department, but we really need that community partnership. And so we wouldn't have been able to do this alone. And as we continue to see our vaccination efforts start to slow down a little bit, it's important to continue to build that trust. And it's important to continue to have those conversations with our partners. And with our migrant farm worker population, it's important to ask what their concerns are and address them and just validate them. And so with that, I think we have a good framework to move forward. That is it for me. And with that, I'd like to pass it up to my colleague, Dr. Patrick McGow.
Thank you, Diana. I hope that everyone can hear me. That was very interesting and insightful, and I would appreciate getting together with you at some point to talk about some of the similarities and some of the things perhaps we could have done better. But thank you for that very insightful information. I am thrilled to be here today and be a part of this group. And I really am appreciative for the opportunity to share some of the things that we've been able to do here. Prior to the pandemic, as we all know in public health, it's so important to establish partnerships and relationships on every business day so that they're ready for things such as the pandemic. And our agency had already established relationships with the Asian American and Pacific Islander community, also known as AAPI, at a 5,000-foot level. And we were doing that by attending district-wide events and sponsoring health-focused small-scale events. Examples include a health and wellness training that we had been offering and coordinating physical activity classes such as Tai Chi at one of our main locations. This outreach became more critical, obviously, once the pandemic hit in early 2020. And interestingly, during this time, much of our outreach work was focused on the African American and Latino populations. This was very similar to cities across the nation. We deployed multiple tactics to reach these demographics, particularly the individuals that were 65 and older, as we continue to work to provide testing and vaccine across neighborhoods where COVID cases were rampant. At just over 3.5% of our total population, state and local data indicated the AAPI community as not being significantly impacted by COVID in the early months of the pandemic. This slowly started to change, however, and we noticed an inverse issue. The vaccinations were picking up steam on locations where we centered outreach, and they were decreasing or stalling in locations we had yet to reach directly. As the nation started to grapple with hate crimes and violence toward the AAPI community, our agency began to take steps to publicly denounce the violence happening across the country and affirm our commitment to ensure equitable access and outreach to the AAPI community right here at home. Our first step was to go back to the same partners we had already worked with to determine need. And based on those discussions, we learned two things. Trusted information was key, and the demographic, particularly the older generation, typically had buy-in with messages that came directly from district associations or their leaders in the AAPI community. The older generation AAPI members were more likely to get tested and vaccinated in locations obviously close to their neighborhoods and where their language was spoken, for example. Based on these discussions, we set out toward two objectives. First, we planned a town hall event featuring medical professionals and leaders from the AAPI community. And then this event was followed by 2 vaccine pods. We promoted the town hall and vaccine pods across local media, but utilize partners from the AAPI community to tell the story and not just our public health staff. Additionally, we recognized it was important to not just hold a pod in the community, but ensure staff at the pod represented the community. While we certainly have wonderful and amazing staff at OCCHD who are members of the AAPI community, we wanted to take it a step further. We worked with the district to recruit AAPI neighborhood residents and medical professionals to assist with check-in and the setup, social distancing, as well as logistics and supply runners during the event. Most importantly, we worked with a local university to train nursing students as MERC volunteers who then participated in the event as both vaccinators and translators. We were pleased with the outcome of the event. While we view one vaccine in one arm as a success on any day, this event saw more than 2,000 AAPI community members receive their vaccine at a trusted location where they saw members of their own community providing services. And while I'm so thrilled with the response, I also want you to hear it from one of our top leaders in the community, Mr. Toon Nguyen, who leads the Asian American District Association. Toon, who just happens to have an MPH, participated with us during National Public Health Week, where we highlighted community partners playing a role in the local pandemic response. And play the video, please.
My name is Toon Nguyen. I'm currently the president of the Asian District Cultural Association. I've worked with Oklahoma County Health Department on a mass vaccination pod for a mix of Asian and Hispanic Latino community. It was very successful. I felt that it needed to be for the Asian community because a lot of our Asian community, especially our elders, have language barriers, a lot of misinformation about the vaccine itself. So I felt it was really crucial to have the vaccination pods for this particular community. It was a very successful event. I felt that, you know, if our overall goals and strategies for our state to be vaccinated, one of the big things that I'm really big on is equitability. You know, having access to care for all communities. I'm glad that OCHD has had that in their mission. I really appreciate all the work that we've done together.
Toon is a great and just truly amazing partner, and we could not have done any of this work without him. And another volunteer at the pod was so pleased with her experience, she reached out to us weeks later and coordinated with us to hold a vaccine pod with an organization providing direct services to members of the AAPI population who are homeless. This critical work continues as we work to build preparedness resiliency in the AAPI community. The AAPI demographic has a high rate of uptake of the vaccine in the Oklahoma City area, where 60% of the demographic has received at least one dose. We're hopeful this trend continues across vaccinating new demographics within the AAPI population, such as children under the age of 11, and across the entire demographic if boosters become authorized this fall or early next year. We are currently in planning stages to participate at the Asian Night Market Festival, which will be in August, and will continue finding opportunities to work directly with partners living and working in the district and throughout our city to reach the AAPI population. And in conclusion, I'm pleased to report we recently received Kresge funding to recruit approximately 150 members of the AAPI community to be trained as MRC volunteers to continue to serve and maintain readiness to reach this population. And I think with that, I am more than happy and pleased to turn this over to our next presenter, LaTanya, and we appreciate Ms. Sylvester being here.
Thank you, Doc. Well, good afternoon. My name is LaTanya Sylvester. I am the Louisiana Director for Resilience Force. Resilience Force is a national initiative to transform America's response to disasters and to enhance disaster preparedness. So in the wake of COVID-19, we saw this epidemic as both a public health crisis and an unemployment crisis. So last fall, Resilience Force, in partnership with the City of New Orleans, launched an entirely new multiracial workforce and job training program called the NOLA Resilience Corps. The NOLA Resilience Corps were individuals, we recruited individuals who were previously worked in the hospitality industry. So if you know anything about New Orleans, you know that we're a party town made up mostly of employees who work in the hospitality industry. So what we did was we recruited those individuals and pivoted them into careers as community health workers. We believe that this pilot program served as first as a lifeline for unemployed and traditionally unemployed workers in NOLA, but we also saw this as a lifeline for BIPOC communities who are hardest hit by COVID. Next slide, please. So, Resilience Force has been in existence for the last 5 years. And as I stated, prior to COVID, most of our work was centered around climate disasters. So, we have Resilience Force members who are across the country, and we typically call them, storm chasers. So they're the individuals that respond to disaster. They're the people that actually rebuilt the homes in NOLA following Hurricane Katrina. And then when COVID hit, we saw that we needed to create additional workforce. One, because we saw the lessons learned from Katrina, and we wanted to make certain those communities that were hardest hit had those opportunities to recover as well. Next slide, please. Next slide, please. Next slide, please. So, I gave a brief history of the Resilience Force and Resilience Corps. I want to talk more about our vaccine outreach program that initially started out as a COVID outreach program to help with testing. So, in Louisiana, the way that our testing and COVID contact tracing happened is if you tested positive, then someone will reach out to you via telephone and do wraparound services. So if you needed medication delivered to you, you needed your groceries delivered to you, these individuals will connect you with the individuals that will bring those resources to your home. And Resilience Force wore those boots on the ground, delivering those medicines, delivering those hygiene kits, delivering food to individuals who had initially tested positive. Next slide, please. So as COVID-19 took hold in the United States in 2020, New Orleans became an early epicenter in an unprecedented public health and economic crisis. I talked about that. Most folks don't know this, but in the early months of COVID, New Orleans was the number one city because of what we think what happened is that there was an outbreak following Mardi Gras. So if you've been to Mardi Gras, there's thousands of people on the ground. So we discovered then that we needed to respond to the disaster, and we needed to put all hands and boots on the ground. Next slide, please. So we launched these community health workers. These community health workers has been beneficial to the response. And what Monica mentioned earlier is that 60% of our community in New Orleans are now vaccinated. It's actually 67% now. As of last week, 67% of the people in New Orleans are vaccinated. And we think it's partly due to this work that these community health workers are doing. What we're doing is developing innovative solutions to the community and addressing those needs and having a real distinct conversation with individuals at their doors and in their homes about why this vaccine is not only important to them, but it's important to their families and then to their community. Next slide. So this is an overview of the day in the life of a community health worker. They are, delivering groceries, packing groceries. They are having conversations with community members about the vaccine, staging up vaccination sites. And they are also still, we're still doing some COVID testing as well. They're also staging and testing at COVID vaccine and testing sites. Next slide, please. So what we also have, identified in the wake of COVID is that access to healthcare is challenging, but for people in Black and Brown communities, it's ever so clear that there are challenges and difficulties accessing healthcare. So we are not only having conversations with people about COVID, but we're also doing resource coordination, and that is, identifying and connecting individuals to other needs that they may be eligible for. That they may be eligible for. So that may be, state and local resources or federal resources that they may be eligible for as well. Next slide. One of the other things that we identified is that, people that are in the Latinx and undocumented communities were the hardest hit in New Orleans and also around the country. So we have developed a team and strategically put together a team of individuals that are bilingual that specifically focus on that community. So, our folks, you can see Miss Patty here having a conversation with some folks at the Mexican consulate, or even like staging up and doing outreach work and tabling at popular Spanish grocery stores and hangout spots. Next slide, please. So what we know about COVID, it not only hit in New Orleans, it not only hit our community members, but it also hit our small businesses. So we developed a special project team called to reach out to those individuals those small businesses who were hit, and connecting them to the Shutter Vendors Grant. The Shutter Venues grant actually provided grants to small businesses, venues that needed assistance and were shut down as a result of COVID-19. Next slide, please. So this is like a description of some work that our small business team did. Next slide, please. So in closing, I would say that in the next few years, we're utilizing resiliency to unlock the possibilities for creating new jobs, good jobs that can help respond to disaster. Those jobs will be, definitely rooted by individuals from our communities, by our communities, having that internal knowledge and being culturally competent enough to respond to our community needs. Thank you. I think that's it.
Thank you, Diana, Patrick, and Latanja for really covering a lot of ground in your presentations and shareouts. We have some questions that came in ahead of the webinar and some that came through the chat box. So I'm going to try to go through as many of them as we can, and appreciate the team feeding us what you're seeing in the chat box. So the first question is, first two questions were actually for Diana. So Diana, the first question is about the cross-sector and cross-organizational partnerships that you described. Were those, did those exist prior to the pandemic, or did your team need to cultivate those relationships once your strategy and approaches had been determined? That's the first one.
Okay. So we had some of the relationships in place. So we had some of those partnerships. The silver lining to this situation was that we had the opportunity to learn about additional agencies and groups, coalitions in our community that were doing work that was very complementary to what we were trying to do. And so we were able to work with them, expand some of those relationships, particularly with our border partners. And so now they have a seat at the table. We're able to talk to them directly. They share their concerns. And again, there was a lot of hesitancy early on with our testing and vaccination efforts, again, because there were very many people that were concerned about accessing what they believed was a government service. So sometimes working with these community agencies was the best way to approach that. So yes, some were in place, but a lot were cultivated and are now actively maintained.
Thanks, Diana. And I think Patrick kind of talked about that, having those relationships in place before are always important. And it sounds like you had some of that and then strengthened new ones. The other question for you, Diane, is about how you measure the vaccination rate in your county. And are you doing that?
Yes, so our state health department actually hosts a very comprehensive dashboard, and you can drill down by zip code and municipality. So one of the things that we used early on to track progress was to work with the local jurisdictions. And every Friday, I provided an update to all our elected officials in the different jurisdictions. And we could break it down by demographic, we could break it down by age group, and then by zip code. And so they actively worked with us to identify sites where we could set up pop-up vaccination clinics. And they every week they said, where are we on track? Where, and they would post messages on their Facebook page or their media outlets to encourage the community. One of the smaller municipalities, actually, when we were starting to open back up, did a promotion on their main street. And if you got a vaccine, you got a voucher to be able to sample foods from the different restaurants. So that was a way to promote businesses and promote the vaccine.
Great examples, Diana. Thank you. This next question, I think, is front of mind for many of us since it's a hot topic, I know, for the public health departments, but I'll just open it up to all three of you since I think you'll be able to add some perspectives. The question is about how you're working with schools, or how can and should schools play a role in assisting with vaccine equity efforts, especially with a lot of places around the country returning to in-person learning and what we know are challenges in getting back to those mask requirements or recommendations. So is there someone who'd like to start? Okay, Patrick.
Well, I think we just had that question today from our media during a little press conference we were having. And I think it's important that we talk about the fact that our team coordinates with our largest school district in the county almost daily. And we also hold a biweekly call, and we've been doing that for over a year with the Oklahoma State Superintendent of Schools and her leadership team. And because we've done that, then we've been able to provide key updates on our response, as well as coordinated messaging and guidance for the schools kind of throughout the whole time. And if we had just a second, that comes to mind, I have a little slide that LT could pull up that shows how many schools we're working with every week in a city this size. And while I think we've just now, I don't know if you all know that, but we've achieved status of the 25th largest city in the nation. And that's new for us because we're relatively small. But this is just an example of the breadth of our touch points with schools. And we primarily partnered with the schools, of course, on tracing and outreach messaging early in the pandemic. So, I mean, I won't keep going, but that's one of the kinds of things that we've done.
Great, thank you, Patrick. Diana or Latanja, did you want to say about how you might be working with schools on vaccine efforts?
Sure. We check in with our schools since the beginning of the pandemic. We've done a daily check-in with all our schools and daycare centers. We coordinated with each school district via the county superintendent's office, and we provided vaccination clinics for all the support staff and the teachers in each school. And in the rural areas, for example, we have a community in Dayton that's in about an hour away. So very small community. The school served as the vaccination hub. So the school principal and her staff actually reached out to everybody in the neighboring communities, which were the really outlying areas. They vaccinated the staff. They let us use our gym. And so because it was a school and they're the community source and the trusted source, they set everything up. So that's been really helpful for us.
Excellent. Thanks, Diana. This question, I'm going to tee it up for Latanja, actually, because I know we talked about this before, Latanja, so, and it might address a couple questions in the chat box and one that we received in advance. One of our participants has talked about and described that they've adopted a door-to-door outreach strategy for some of their neighborhoods, but have gotten feedback from more rural Republican areas that has really been aggressively opposed to this type of door-to-door campaign, which we know is what a lot of you are doing with your community-based workforces. So can you talk about some ways that you might address some of those challenges that have been described in that question, Latanja?
Sure. And, our model, we have a distinct, model, similar to like a campaign, a political campaign, but also to a house visit doing organizing. You know, my background is I was president of SEIU for the state of Louisiana for a very long time. So we implemented some of those strategies into those one-on-one conversations. It's like, you know, one of the things that we do, we pose the question, you know, have you been vaccinated? And if we feel that there is some pushback, our community health workers, you know, they go into this distinct conversation about like the importance of being vaccinated, not only for themselves, but they also talk about something that I mentioned earlier in my presentation is this wraparound service, like to reduce some of that pushback and say, what are some of the other things that you may be eligible for? There's this system called Unite Us platform that we're using, and we're connecting individuals to resources that are available. And then, you know, we then take some of that pushback from them so that we now are in a trusted conversation, because I'm not only here asking you to get vaccinated, I'm also here to help you, right? If you haven't received your unemployment benefits, we'll connect you with someone from the Louisiana Department of Workforce, right? If you haven't received, you need to learn more information about the child tax credit, we're connecting you to individuals that, you know, that can assist you with that. And then at the end of the conversation, we pose the question again, you know, how do you feel about the vaccine? You know, do you feel comfortable now that I'm a trusted messenger? You know, I always talk about Miss Pam. Miss Pam is from the 7th Ward, lived there a very long time. And Miss Pam has always been the go-to person in her community. Now folks are coming to Miss Pam asking about the vaccine. So Miss Pam had been a community health worker prior to even being paid to be a community health worker. She was a community resource person and now what she's doing now is responding to some of those questions that folks would have typically asked her anyway. And she's getting paid to do so now. So that, I mean, that's one of the strategies that we're using is like, you know, resisting and pushing back on folks and providing additional services that we think that they need to be eligible for to gain that trust from the community.
That's very helpful, Latanja. So definitely what I'm hearing is not just talk about the vaccine, but then to build that trust in those few minutes that you have to share the other important resources that are really things that that community members are struggling with, and then going back to the question at the end. There's another question for you, Latanja, in terms of, you know, possible plans from Resilience Force to expand the program in other communities outside of New Orleans. Can you say a little bit more or share updates? I know you talked about that with me in terms of some preliminary conversations you were having.
Yeah, I would say that the work that we're doing in New Orleans has proven to be successful. As I stated, 67% of New Orleanians have at least received their first shot. However, in other areas and parishes, counties across the state of Louisiana, you know, it's, you know, as low as 32% and, you know, 39%, right? So we're having conversations with Louisiana Department of Health about deploying this same model into other areas around the state. And it is the same, you know, concept, I would say. It isn't for us, meaning, you know, people from New Orleans going into those areas, you know, asking individuals to get, you know, a vaccine from someone they've never met. What we're attempting to do is train those individuals in their community, by their community, who understands their neighbors on how to do this work and how to have those distinct conversations with their neighbors and their families and friends about the vaccine.
Great. Thanks, Latanja. This question is for all of our panelists, and this is something that we talk about a lot on the public health side, the difference between vaccine access and misinformation. So hesitancy versus misinformation, which are two different things. And so there is a question about those strategies. I'm going to combine some questions here. What are the best strategies that you've used to get the remaining unvaccinated folks on board? Because there is still a lot of misinformation circulating in our Black and Brown communities. So it's not a lack of the supplies again. It really is about getting the right information so that they can make the best decision for themselves and their families. So I'll just open it up to all of the panelists.
Well, I think if I could just start off, because I may not have as much to say on this topic as the others, but I know that what we have been very successful, kind of combining some of the other questions, Monica, that, we're a Republican state. I can't really speak to some of these things statewide because we're a metro, autonomous, independent health department. So we're not part of the state health department. Tulsa is a partner to us and they're the same way. So a lot of the things, really everything that we do, it's about our county and our city. And then we want to help and support and be part of the state health department as much as we can. But what we've done in Oklahoma City and in Oklahoma County in particular is, as you mentioned, vaccine is readily available. I mean, they can get it at the pharmacies, their doctor, I mean, anywhere and everywhere people are giving the vaccine. And I'm really proud. But we are the most vaccinated county and city in our state. And how we have done that is because we are targeting when it slowed down and people quit responding. We had pods sometimes in the thousands, multiple thousands that we were taking care of each day, maybe giving 50,000 per week sometimes. And then what we ended up doing is, we were offering pods and maybe 200 people would show up. So when it got to that point, we began to just really target populations and go directly to, we would contact a local leader that was a faith leader or that was some particular minority or culture group leader, and we would go directly to that community, including our LGBTQ group. We did the same thing with them. We are fortunate enough to have on our board a member of the LGBTQ community that does phenomenal work. And he has always been really active. And then our mayor appointed him to our board, and it kind of changed everything for that community. And so working with all of the local elected officials has been very powerful. We have a very active community right now toward equity. And we are not there. We have so much to learn. Our health department has so much to learn, but we are striving to work with those individuals. And so we have weekly, sometimes more than that, daily calls with especially our city council members that represent Black or Latino communities or LGBTQ. So we're trying our best to target and take the vaccine to people. And I know that Diana mentioned earlier what they were doing with folks that were homebound, and we created a homebound program. So we are just basically delivering a vaccine to people in their home that can't get out. So if they don't have access, if there's some financial reason, if there's some type of communication barrier, we've tried to cover everything that there is. And I think that led to our success in being the most vaccinated city and county in our state.
Thanks, Patrick. Diana or Latanja, did you want to add from the experience that you've both had?
Yeah, I think the secret has been for us in New Orleans is our partnerships with community-based organizations and faith-based organizations. Actually, outside of the Louisiana workforce, we recruit most of our community health workers from those institutions. So, being the culturally competent, the folks that are the staples of the community, I think has proven to be successful for us, and how and why we've been able to reach such high marks as relates to vaccination. But as it relates to other parts of the state of Louisiana, we too, like New Orleans is just this blue dot in this red pond. So one of the ideas that I'm tossing over to the Louisiana Department of Health is, yes, we're going to train individuals, but we also are going to have like on Monday, we will, canvas and do the door knock and, have folks get a little bit more comfortable with us, and then and schedule an appointment for the next day, and having those homebound vaccinations done, and having that community health worker there holding individuals' hands. I think we're far past those individuals that were on the waiting list, those individuals that are maybe, a little, on the fence on getting the vaccination. Now it is, changing the hearts and minds of individuals who's heard all of this information on social media, who's heard it in their community and sometimes in their barbershops and beauty salons, and dispelling some of those myths by, but then also I think that there are some people that just isn't comfortable with, getting vaccinations, taking medication, who have totally in their lifetime hasn't done anything or been close with any healthcare system. So I think that for us is, making those folks feel comfortable. If it requires holding their hand in their homes, then we're going to do that. If it requires us going to the vaccination site with them, driving them to the vaccination site, we're going to have to do that as well. I think that we have to do some innovative or take some innovative approaches to this now group of people that we have to convince that in order for everyone to be healthy in the state, in the state of Louisiana and in this country, that we all have to do the work. We all have to get vaccinated.
Thank you. And Diana, from your perspective, since I know you talked about the border community and some of the work that you've done with undocumented residents, that requires building that, having that trusted relationship. So any perspectives that you'd want to share?
So again, working with the promotora model was, instrumental, but working with the Mexican consulate and just making sure people knew that the vaccine was free and accessible, that they wouldn't have to provide, that it was available if you were here, regardless of your status. A lot of that outreach and trusting, and it meant sometimes we didn't go out with our formal, health department shirts on because sometimes that discouraged people. But again, working within the community, and I think the door-to-door campaign was very helpful. Because we were able to determine whether it was an access issue, so maybe you needed transportation, or whether it was hesitancy. Some people just don't like, I've been surprised, many people just don't like needles. And so the hand-holding technique is actually very helpful, or whether it was misinformation, and just acknowledging people's concern, acknowledging that they're valid, and then doing your best to answer those questions in a respectful, factual way, I think has been key.
Thank you. This next question is really specific. So any tools or resources or advice that you might give to address vaccine hesitancy among those who are pregnant or thinking of becoming pregnant? This is, I know, part of the misinformation and people trying to get as much information as they can. So any tips or tools for this particular group or population that you'd want to share or highlight?
Yes, so most of our information, we work closely with the New Orleans Health Department and the State Health Department in distributing messaging tools. And what I've learned is that each handout looks differently in each community. That is extremely important. What the messaging looks like in New Orleans isn't going to be the same messaging that we distribute in Baton Rouge or in Lafayette, which is much more rural. So I would suggest just work closely with your local health department in developing those tools and those messaging ideas in order to reach that population.
Thanks, LaTonya. We have a couple minutes. So why don't I do a kind of a quick rapid fire with this last question, especially since you're all in southern states, Southwest. So there was a question about how you've addressed the seemingly political partisan nature of vaccine hesitancy, going back to your political context. So really quickly, each of you, if you wouldn't mind taking this last question, and we will take all the questions and we'll see if our panelists can help provide answers to those offline. So Diana, do you want to go first?
Sure. So every week for the past year and a half, I participated in an elected official meeting every Friday, and it included our state, our congressional, our local leaders, and our business leaders. And so we talked about being in this together. And this was a health issue. And if you wanted to keep your schools open, because we know how important that is for kids, especially the little ones, if you wanted to keep your businesses open, if you wanted to keep your community centers, so it's about addressing it in a way that's relevant to the different sectors. And we are all in this together. So, you can't target it and avoiding the shaming people or making any sort of implication. It's about how is this relevant to you? And I had people say, I don't believe in the vaccine, but I have an elderly mom who lives with me, so I'm going to do it to protect her. So it's about what's relevant to you and what you're willing to do. And in the end, we're all going to, get through this together. So.
Great. LaTonya?
So for some reason, and I guess most of the professionals understand this far more than I do, that healthcare has now been politicized. So each week I spend time on a call with state representatives and state leaders from around the state updating them on the work that we're doing on the ground and just sharing information that we're hearing from the ground with them. I talk to folks that are, in each district and say, hey, we are going to be in your community this week on this date. Or I follow back up with them the following week and say, hey, this is what we heard from your community. Is there any assistance that you need in getting the messaging out? Can you co-host the event with us? Can you work closely with us on distributing or any messaging that needs to go out into your community? So it's unfortunate that, healthcare and vaccine has been, highly politicized, but we have to push back on that messaging and provide the truth, and it has to come from trusted individuals in the community that can have those drag out, pull out, sometimes over beer and shots conversation with their neighbors over a barbecue, so that they can feel more comfortable about getting this vaccine or getting a shot in the arm. It's important to our community. It's important to our livelihood, specifically in New Orleans, where a large percentage of the folks that currently works as community health workers formerly work as bartenders, in some of the bars around the city. So, for us, it's real, and for us, it's important. For us, it's important to us to make certain that everyone get vaccinated. It is far past herd immunity. We want everyone vaccinated.
I love your enthusiasm, Latanja. And last but not least, Patrick.
So I agree with everything that Latanja and Diana have shared on that, and we do similar things. I would say that this piece where the Biden administration has basically asked all of us to implore those people that have been vaccinated, like what's the story they need to tell to get their nephew or their aunt. And we are using that. And we did that very thing today, even because what I simply wanted to bring in all our media today and talk to them about the children, because who right now is very vulnerable are those individuals less than 12. There's no vaccine available. People are going back to school. There are teachers probably going to go teach in some of these schools that are not vaccinated, on down the line. We all know the terrible tragedy that is out there is that a child is going to be hospitalized. It's already happening, that a child will die entirely unnecessarily because people have not been vaccinated. So what we did today was appealed to the residents of our city and our county. Please do it for the children. I mean, we're talking about, the babies to 12-year-olds that don't have vaccine available to them yet, while an adult has that opportunity but refuses it. So if they won't do it for themselves, then do it for a child. I mean, and that's literally what my motto is right now. In our state, the next group that is not vaccinated that's so severely lacking is that 12 to like 17 or 17 to 30. I think everybody's kind of seeing these same dynamics. And so again, most of these people are teenagers and children, and they're not even, they're still minors, and someone else is making their decision for them. And if that's not the case, there's not even a vaccine available. We've got to appeal to people's best nature. Like Diana, I think, mentioned it, and it may have been Latanja, but even if they don't think they need the vaccine, they're doing it for their grandmother. So we've got greater than 91% of our people 65 and older have been vaccinated in Oklahoma City and Oklahoma County. But in those children, they can't be vaccinated. So I'm asking people, we ask you to do it for grandma. Now we're asking you to do it for the babies.
Well, on that note, Patrick, definitely a call to action, and with gratitude from me and on behalf of everyone who's participated for all of the outstanding work that the three of you have been leading in your communities. Some themes that I heard was the importance of community and grounding your work in equity, and all of those important collaborations and partnerships that you've had and developed and strengthened throughout the pandemic. So big thank you to our panelists and for all of you for attending today. We'll be sending out the recording as well as links to all of the resources mentioned. And please visit the Vaccine Equity Cooperative website at vaccineequitycooperative.org if you'd like to learn more information and connect with any of our speakers this afternoon. So thank you once again, and I hope you all enjoy the rest of the afternoon.